In this upcoming video, I'm going to talk with Dr. John Urse about PRP, better known as platelet-rich plasma. Enjoy the segment. So let's focus on PRP for a second then. So PRP, or platelet-rich plasma, is also used to treat conditions that are orthopedically related, correct? I remember a football player tearing an Achilles or having an Achilles strain and reading where he went into his doctor and got a PRP injection. Was that done to accelerate healing?
It was. It was done to do two things: cut down inflammation and pain, but also improve healing and recruit what are called growth factors. And platelets have a tremendous amount of growth factors, over 1,200 different types. Some are in the vessels, some are in the different cells, but those various growth factors help with healing, speed recovery. We even see open heart surgery patients who get their breastbone closed after heart surgery have a PRP injection placed along the incision line of the bone to help it heal faster and reduce that pain. So when they put it in the Achilles tendon, or if we put it in a Tommy John ligament of the elbow, or a muscle tear of the hip or knee, those are meant to decrease pain and improve function. Now, it's important to make sure it's not a complete tear where it's detached, because nothing is going to repair something that's completely detached. So we're talking about where inflammation or partial tearing or fraying is occurring, or a ligament has been partially stretched, and those ligaments and tendons are some of the other applications of the platelets and orthobiologics that we use that aren't related to disc arthritis.
Okay. How about a PRP injection? Would you have the same restrictions on me if I got a PRP injection?
Not at all. Those are simple injections of your platelets. Those go into the knee much like a cortisone shot. You do regular activities, you can drive. We don't give you a pre-medication for that. So normal activities that day and the next day.
Okay, just so I understand, PRP, I can come in, get a shot, drive myself, go back to work. Stem cell injection, you're going to give me some sort of light sedative by mouth, and you recommend I come in with somebody to take me home that day.
That's correct.
Okay. So we've talked primarily about the knee. I'm here, you said I need it in my knee. But can I get PRP or stem cells in any joint that I have?
You can. They don't fit too well in small joints of the hand. One of my partners is doing a study on the base of the thumb joint. With platelets, you can only get about a drop or a cc or so in that small joint.
Okay. Now, I had told you also that I had lateral epicondylitis, or tennis elbow. And you had mentioned that we might be able to do a shot for that. What kind of shot would you do for somebody with tennis elbow? Is it the same process?
It's a similar process, but it's easier because it only needs a PRP or a platelet injection.
I see.
There's two types of platelet injections. One with white blood cells, where you want an inflammatory response to stir up healing. That's the kind we use on an elbow. In fact, the studies that are out about the treatment of tennis elbow show a single platelet injection using an ultrasound to put it in the right place works better than a cortisone shot or physical therapy for that problem for up to 2 years. Now, that doesn't mean if there's a torn little tendon there that it wouldn't need a surgery someday, which might fix it definitively, but if you're busy, you're working, hammering a house together, you may want to have a up to 1 to 2 year improvement in your symptoms with a simple PRP injection.
And if I recall, you were saying that's where I would come in and you would get blood, just like I were giving blood at a center, and you would take my blood, spin it down in a centrifuge, come back with a small amount of the PRP, and then just inject it again under local right here, and I would leave.
That's correct. That's just a simple, more powerful injection, because platelets have about 1,200 anti-inflammatory proteins that help that pain and inflammation in the elbow. And that's the stuff we want in the area of injury or pain or disease.
I hope you got the information you were looking for on PRP. Thanks for tuning in.